Okay, today on our podcast, we want to talk about the number one reason a child enters a pediatrician's office, the number one reason a young baby will enter an emergency room, and the number one reason for giving antibiotics in this country. And we are talking about ear infections. Now, nearly every parent has to deal with this. A very high percentage of babies and young children get ear infections, and it can be very hard because it's also painful. And you could see that in the child's face and how they're reaching and trying to clutch their ear and such. And what most parents will do is bring them to the pediatrician, and the pediatrician basically has one initial weapon, if you will, and that is an antibiotic. And it is given quite commonly, antibiotics in this country, and like I said, for ear infections specifically. So this is the basic course, and oftentimes children will get repeat ear infections. So in other words, it didn't really take care of the problem. It just took care of the symptom temporarily, and yet the child will come back with another ear infection and another ear infection. And then we have additional problems sometimes with fluid in the ear that doesn't drain, and now the child has difficulty hearing, and there's fear around speech development. And the next step is to try tubes in the ears. So this is very common with young kids. They'll get ear infections, they'll get antibiotics, they'll get more ear infections, more antibiotics. Sometimes they'll use steroids, and then tubes in the ears. And all of this needs to be looked at a little bit more carefully, since the majority of ear infections are of a viral nature. So antibiotics are completely useless. So if the majority of ear infections are of viral nature, then a lot of kids are taking antibiotics unnecessarily, and in the process are taking a risk, since there are dangers to taking antibiotics. The immediate dangers are this potential side effects, which the mild ones consider, a rash and fever, and rash and vomiting and those kind of problems, diarrhea. But there are more serious ones, and they include death. Not every child can process an ear infection and an antibiotic, and you can have a reaction where the liver cannot process the medication. And then you have the tubes in the ears, which is a general anesthesia. The child has to go under. They'll take a lance and cut into the ear so that they can put the tubes in. And so this is also obviously a risk to the child. So all of this to treat something that can be healed naturally, since most ear infections will heal on their own without any intervention at all. And in fact, this is the watching and waiting so-called protocol from the American Academy of Pediatrics. This is the recommendation for most kids, is to give them a chance to heal from within, since most of these infections are viral. And even if some of them are bacterial, they still can heal on their own. The body can take care of this because too many of these antibiotics are given out. And now we have antibiotic-resistant diseases that are so severe that these diseases with these fancy names, they cannot be treated at all. And, all they could do is hope and pray that the person doesn't die. So we've created a lot of superbugs basically by overuse of antibiotics. And when it comes to ear infections, which is the number one reason that we hand these things out, we need to find another way to empower the little baby or the little child to heal on their own, since first of all, they're going to do it most of the time, and we just need to trust. But we need to take a closer look to see why maybe the ear infections are occurring in the first place and why there is fluid buildup. And in a pediatric chiropractic office, this is exactly what we do. We're concerned with cause. In other words, we're not interested in treating the effects. Antibiotics only treat the effects or the symptoms. They don't get to the cause of the problem. Why is the immune system not functioning properly, and why is there fluid building up in the ear? So what we see, just like we talked about in our other podcasts, is that the most common problem is damage to the upper neck, and this is very, very common at the birth process. Yes, there could be intrauterine constraint, and sometimes it happens within the womb, but during the birth process, often there is pulling, either with the hands or forceps, vacuum extraction, that puts tremendous strain on the upper neck and can create misalignment. So in other words, the bones can misalign and become fixed. And in the process, it'll do damage to the nervous system and the body's ability to drain through the lymphatic system in the upper neck and the head. So this is something we see all the time. My last podcast, I think we talked about the baby that was vacuum extracted, had damage to their neck, couldn't turn their neck. We call that torticollis. And this was all coming from the birth process. So a lot of kids are born this way. They leave the hospital with a perfect APGAR score, 9.9, but yet they do have some damage to the neck. And within a matter of weeks or a few months, suddenly they have ear infections, they have problems. And you cannot blame this on the eustachian tube being more horizontal in the babies. Well, that's the way God made you. It doesn't make sense that God made you so that you'll get ear infections, right? So it's not the way the babies are made. The problem is that the fluid cannot drain. And when you have misalignments and fixations in the upper neck, it interferes with the body's ability to drain fluid from the ear through the lymphatic system in the neck. So this is why we see such great results with pediatric chiropractic. We start adjusting these kids. Oftentimes they sleep right through the adjustment. That's how gentle it is. And the fluid starts to drain, and these kids do really well. The infection clears up. And for most of the kids that we check, especially if we get to check them early on and from birth, these kids simply do not get ear infections. So where most kids are getting the ear infections, these kids aren't even getting them to begin with, because their immune system is healthier, because their nervous system is fully in control, and they're draining. So when there is any fluid buildup, it doesn't really get a chance to build up that much. It immediately drains into lymphatics and back into the bloodstream, and the body can take care of itself. So essentially, these little guys, even though our immune systems are just forming, they can heal themselves. You know, assuming they get some other things, you know, they get breastfed and they're in a good home and the stress levels are low. They just need a proper functioning nervous system. And unfortunately, the birth process interferes with that. And no amount of antibiotics and steroids and tubes in the ears are going to empower the body to get stronger. They're only going to treat symptoms, and the child is going to end up with additional problems in the future because if your immune system is suppressed, it's going to be weak, and the child will be susceptible to additional issues, such as more ear infections. And if they're taking antibiotics has been tied to increases in weight gain with young children, increase in asthma rates, and allergies. And then we have all the side effects, which we already discussed. So taking a drug or a medication is not necessarily the best choice. It may be a short-term choice, but it's not going to help the child for the long term. What we really want to do is empower them to be healthy now and into the future. And that only happens from the inside out, when their body gets to heal, when their body gets to work, when their immune system gets to do its own work. You know, a muscle gets strong when it works. And if the immune system has the opportunity to heal something from within, it actually gets stronger and stronger. So we want these kids to be stronger and stronger and stronger as they get older. And if you keep giving them antibiotics, you're actually getting them weaker and weaker and weaker. And they're going to have bigger and bigger problems as they get older. So this is something that we want to see improved in terms of treatments, that these kids are given the opportunity to heal. Now, as a pediatric chiropractor, I don't touch the ears. I don't put anything in the ears. I'm not treating infectious disease at all. All we're doing is improving the health and the integrity of the nervous system by adjusting the spine. And like I said, most of these kids, they really enjoy the adjustments, or little babies will literally sleep right through. They're very gentle. And we see results all the time with these kids. They simply don't get the ear infections again. If they've had them, and if they've never had them, oftentimes they just simply don't get them in the first place. So this impacts all levels of health, from all the common problems in childhood. When their nervous system is affected, more of these problems will occur. And when these kids get corrected in a pediatric chiropractic office, a lot of these things resolve on their own because now their body is able to heal it from within. So this is the message for today's podcast. Empower those children. Get them checked by a pediatric chiropractor after birth. Even if everything looks good, they may have a problem that won't show up for months. And at that point, it gets harder and harder to correct. But with babies, it's usually pretty easy. We check them early, and we check them periodically, and we just keep them healthy. So I'm sure every parent would rather keep their child healthy than to deal with that look on the child's face of pain and grabbing their ear and feeling like they have no other choice but they get a medication, which, most parents, they don't want to do that. They're doing that because they don't feel there's any other choice or any other option. And the options should be to watch and wait and make sure that their nervous system is functioning properly. Medication should not be the first choice here. It should only be used in reserve. So that's our message for today. Let's keep our kids healthy. Let's get them checked by a pediatric chiropractor, and fewer and fewer ear infections if they occur at all.